So the Role 2 is Army's first in a long time deployable damage control surgical facility or capability. And it's designed to provide definitive care as far forward in the battlefield as possible. It shortens the time between point of injury and surgery, which increases the ability for soldiers to survive traumatic injuries by quite a large extent.
The Role 2 Basic Hospital is a key component of the CASEVAC framework. We had members who delivered Role 1 care. Patients were then evacuated back to the Role 2 Basic and then prioritised according to their clinical need and then distributed throughout the health facility depending on what they required. It's really important that we simulate CASEVAC chain and the mass CAS event. There's a lot of moving parts, obviously, in evacuating a patient from the front line. You've got patients with competing priorities and lots of them, and that can be very challenging. It's very important that we practice that.
So setting up the basic for this operation probably started the day before when we were packing it down. The conditions were austere. It was muddy, humid, and raining while we were doing it. So once we set up the exterior, the surgical team actually chose the most cleanest tent for us to work in. At that point, it was probably 2 to 3 hours that it took for us to clean and then establish a clean and dirty. So myself and a couple other nurses stayed in here and we would accept all the clean equipment that was required to do the surgery while the rest of our team was providing it to us from the outside.
When patients are received to the Role 2 Basic Hospital and they require surgical intervention, they come into the operating room here and receive damage control surgery. This is the first time we've performed such an operation under anaesthesia in our deployed field hospital, a shortened operation where we stop bleeding, prevent contamination, prevent ongoing injury, and then the patient is moved on to a higher echelon of care to have further surgery if required. This is an evidence-based practice from civilian trauma care to enable improved survivability from battlefield injuries.
So for me, it was a bit nostalgic because I was part of the conception of the Role 2 Basic. To be able to see it move through paper to the first iterations to now working overseas in a field and doing a surgery, it was actually an achievement from the whole team, but personally for myself, it felt amazing because we all knew our bit and we all knew what we had to do to get the job done.